Hey guys, I'm Dr. Cosentino. I'm the president of Empire Medical Training, and I'm here today with Dr. Robert Stahl, who's an interventional pain management physician, and also Larry Smith, who's a nurse practitioner, and he's a sports medicine practitioner, sports medicine specialist. As many of you already know, Empire Medical Training, we do a lot of training and a lot of different things. We do aesthetics, we do pain management, we do functional medicine, and my passion is all those things, but I started out actually early in pain management. And I like to just take a minute or two to talk to my colleagues about some of the different procedures that we do in pain management, because there's so many very, very good opportunities. There's so many great procedures and opportunities for primary care physicians, for mid-levels, for nurse practitioners. And we were talking earlier about one of our courses, the perineural injection course, and I think that's so interesting. And I wanted to see if you could maybe say a few words about that course and some of the other ones that we have as well.
So the perineural injection course is a pretty exciting offering we have through Empire. It's a very high benefit, low risk, low cost way to enter into regenerative medicine. We're utilizing peripheral nerve injections with non-toxic restorative solutions to stimulate the neurogenic component of tissue regeneration, healing, and pain reduction. So it allows you to get your foot on the ladder of regenerative medicine without the requirement for a lot of specialized equipment. You don't need a centrifuge, you don't need specialized needles or syringes. Many of the protocols can be done without image guidance even. So it's the single most user-friendly way to explore that option for chronic pain. And it also, one of the nice things about it is a lot of things you have a difficult time combining them with platelet-rich plasma because you don't want to short-circuit the inflammatory response of the PRP. But PIT and PRP can actually be combined to provide not only acute pain relief, but also more long-term healing because they don't interfere with each other. I've also used PIT for post-procedure pain reduction in other scenarios. And the best part is the substances that we use, it's nothing that you're going to see a patient ever have an allergic or a toxic reaction to. The cost is low, pennies per procedure, and the reimbursement can be very high. Some of the peripheral nerve injections that we teach in the course, you might get $200 for one injection.
And that could be combined with other procedures.
It can be combined with PRP, and it can be combined with other things. I've even combined it with radiofrequency ablation because it helps manage the post-procedure pain without having to add steroid or opioids or other analgesics.
I was going to ask you about our typical course. Like, there's so many different types of specialists that we have. Can you say a few words about that? It's not just physicians, it's who's qualified? What type of practitioner could take the course?
We have students come to our courses who are MDs and DOs, of course. We also have nurse practitioners, we have PAs, we have chiropractors, we have physical therapists who have come and taken our course. And I think there's a little bit of something for everyone. I also think that people sometimes underestimate how accessible much of the curriculum is for them. So for example, when I first started doing this, C-arms for doing fluoroscopically guided procedures were prohibitively expensive for a lot of people. They could say, well, I see that course is interesting, but I don't see myself ever doing it. With more companies offering refurbished pre-owned C-arms with warranties, I now see people getting into the fluoroscopically guided procedure market for less than $25,000 when it used to be quite a bit more. There are now some companies where you can get a mini C-arm for fluoroscopically guided peripheral joint and extremity injections for $8,000. We've done preceptorships with people who have one in clinic. It no longer requires a lead-lined room. Unless you're in a hospital and are complying with Joint Commission, it's much more accessible than it ever was before, much more affordable. And again, this is something that rather than losing that revenue and referring to another provider, this is something that could be added to your own practice.
You know, it's funny you talk about the joint injection. It's incredible how popular that course has become. This is actually one of our most popular courses, the non-spinal joint injection extremity course. It's very, very popular. Maybe one of you guys could say a few words.
It allows for the primary care provider to do the knee, hip, and shoulder injection in the clinic, not having to send the patient to an ortho that could take 2 weeks, 3 weeks to get there, and then they do the procedures, do that in-house. The revenue stays in-house. The patient doesn't have to wait. You can do something for your patient today.
And I know the doctors when they teach, I haven't taught lately actually. I started this 27 years ago. I did a lot of teaching back then, but when you guys teach now, you really get into the reimbursement, especially like with all the different procedures. There's so many procedure codes that are associated with it. We also teach the viscosupplementation, and there's specific codes with that. Even prolotherapy and trigger point injections, all the large joint, all the small joint injections, they're all associated with special codes and reimbursement. So it's important. I'm glad that we teach that as well.
We want people to learn how to take good care of their patients, but we also want people to get paid a fair wage for their work.
That's right, yes.
One of my early instructors at Empire, I learned from him that medicine is an art, a science, and a business.
Okay, yeah, I like that. That's right, I agree. You gotta know all three to be successful.